Right, good afternoon, everybody. Welcome. It is so nice to see so many people here in person from the wider IDS community and also online. Welcome to all those who joined us as well. My name is Peter Taylor. I'm Director of Research here at IDS, and I'm also have been leading the COVID Collective, which we'll say a little bit more about in just a moment. And today, we're very happy to be here together, both in person and online, to launch a special issue of the IDS Bulletin. So a little bit of background before we talk about who is also here and who is going to say what. I think we all know that in early 2020, the world became aware of a global threat. And we saw the spread of COVID-19 upending the lives and the livelihoods of people around the world. And so clearly an enormous research need opened up very quickly. And we were happy to receive support from the Research and Evidence Division of the UK's Foreign, Commonwealth and Development Office to initiate a social science research programme that focused on the impact of the pandemic. And that initiative was called the COVID Collective. So given the scale of the challenge, we wanted the collective, as its name suggests, to be collaborative. We want it to be based on really strong, equitable and transparent partnerships, and also to really put engagement and communications at the heart of everything we did. And the purpose of the COVID Collective is to generate research and knowledge in response to the most pressing development challenges emerging from the pandemic. So this required a very rapid response, given how quickly everything was changing, of policy relevant evidence to inform decision making, both in the midst of the crisis, but also through this extended period that we are in now throughout the world and beyond. And we believed that this really required a need for transformations in perspectives, in worldview and in practice, and that this could only really be achieved through a genuine integration of social science alongside other scientific approaches which were being adopted. So we know that the situation was very fluid and dynamic. We're looking back at our original proposal that we shared with Research and Evidence Division in 2020. So in July 2020, we had seen 650,000 reported deaths due to COVID-19. By September 2022, roughly where we are now, over 6.5 million reported deaths. And that's probably an underestimate of the actual number. And I think just the extent of that demonstrates why research was so important. Citizens were dealing with unpredictable policy responses. There were problems of trust and governance institutions, and there were enormous negative impacts of the pandemic on the lives and livelihoods of people who were already experiencing marginalization, exclusion, and a range of vulnerabilities. And the COVID Collective has expanded. It began with 8 original partners, many of whom are represented on the call today, coordinated by IDS. And in 2 years, we saw that initial partnership expand to 28 partners with 56 projects in 34 countries. And one of the things that we became aware of very quickly, just through the multiple conversations we were having with our collaborators, was that the way in which research was being done was changing. It was adapting, it was evolving, new methods were emerging, and that in itself was generating a lot of very significant learning, as well as the actual findings and the evidence that was generated through the research. So we realized that through this array of projects, we could actually see approaches to research changing in real time. And we felt it was really important to try to learn about that. You'll see on your tables, if you're interested in some of the projects which are included in the COVID Collective, there's a brochure on your table, which is really hot off the press. It's probably still warm, actually. And you're welcome to take those. It's also all online. We have a website, covidcollective.net. And that's the source where you can go and you can find more information about the wider collective. I think one of the things that I would just say as well before we move into hearing from our amazing panel today is the sense that the research from the COVID Collective has not only shown how we do research is evolving and is changing, but it's also really exposed the deep foundational cracks in society the fragilities and the vulnerabilities in systems of all kinds, playing out at local, national, and global scales, and really in every country, including in the UK where we sit right now. And so through the COVID Collective, there's been collaboration not only with the partners with the projects, but also every project has been partnering with communities, with researchers, with civil society, with policy actors, with practitioners on the ground in multiple contexts, doing research together, co-constructing research together, and learning together. And in a sense, that's contributing to a systemic transformation about how research happens, as well as trying to understand how systems need to change. So you can find much more information about the COVID Collective online, and that will be something that I hope you will follow up afterwards. And if you have any questions, there will be time for Q&A a bit later. But right now, I would like to introduce Paul Knipe, who has co-edited this bulletin with me. I had the great pleasure of working with Paul. Paul worked here at IDS for many years. He was managing our Knowledge for Development initiative, and last year took up the opportunity to become Director of Consultancies, Impact and Influence with INTRAC. So he's back with us today, and he's going to get all the attention because, I know people are really happy that he's visiting us as well. But we also have Paul will introduce in a moment. But Paul is now going to say a little bit about why, to look at the bulletin, why we wanted to write about this evolution and adaptation of research methods in a special issue, and then to introduce our panelists who are going to share more of what they have written about as well. Paul, so I have to give you this. There we go. Robert Chambers would talk about handing over the stick, handing over the lapel mic. It's going to work there.
Okay, I hope you can all hear me. Well, hello everyone. Thanks, Peter. It's wonderful to be back at IDS. As Peter says, I was here for a number of years. I've been where you're sitting quite a lot, but this is my first time on this side of the table, so to speak. It's great to see so many colleagues here and online. So as Peter just said, I will just briefly give some background and framing for this special bulletin edition, and then introduce our wonderful speakers that we have here today. So just building on what Peter said, the idea for the bulletin came about fairly early in the pandemic. I believe it was early in 2021 or the end of 2020 or thereabouts. And this was at a time when the implications to carrying out research, given the restrictions on movement, social distancing, health risks, and other measures were becoming very widely known, along with realization of the many systemic inequalities that Peter's just mentioned, that the pandemic was highlighting and indeed exacerbating. So through the COVID Collective's social science research projects, and its collective learning events as well, and these learning events were supported by evidence syntheses of sort of academic journals and grey literature. Of course, that was hot off the press as well at the time. More was becoming known about the challenges faced by researchers and commissioners of research across the world. So in responding and adapting quickly to overcome challenges, we were seeing real-life examples of innovation, of creativity, new ways of working and opportunities that, as Peter has indicated, would potentially have long-lasting effects on how research would be done and could continue to be done going forward. So against this backdrop, the bulletin came about. The collection of articles in the bulletin and the short addresses we will hear here today from authors of all the articles relate to a vast array of topics, geographies and contexts. So each article describes methodological innovation and approaches a different dimension of research, but it's always anchored in the relevant literature. But crucially, I think it's providing that real-life example from concrete settings. So including implications and recommendations for policy and practice. But the articles are drawn together around the carrying out of social science research that rapidly adapted to the immediate challenges of the pandemic, as we're saying, often resulting in sort of creative solutions, which we'll hear about. So importantly, these are solutions that approaches that align with and are part of these shifts in how research can be done. And I think these are really, really crucial now and very relevant. These were debates that were going on already, but I think were accelerated in many ways by the pandemic. So as such, the bulletin explores themes and gives perspectives on aspects like shifting power, so decentralizing research and decision-making, working through more equitable partnerships, addressing knowledge asymmetries. They talk about the challenges of access and engagement, work that worked effectively for research participants, ensuring safety and inclusion of the most vulnerable amid this unprecedented challenge. It talks about how to gain consent and incentivize research despite working remotely. And I think, very importantly, utilizing the new emerging technologies and balancing this kind of remote way of working with person-centered approaches when the situation allowed that. And all of which, I think, while maintaining the integrity of the evidence that was being produced. So just to, I think, finish on this before I introduce the panel, going back to the title of the title of the bulletin, it was about ensuring the multiple perspectives and the voices and the views that were being heard, continue to be heard, and that these were critical for the responses of the time, so they could still be heard and shared. But I think, as we've said, has true implications and opportunities and long-lasting aspects to how research will be done and done differently in future. So I will leave it there, and I will just introduce our panel. So most of our panel are online, and we have Morgan here beside me in person. So first of all, it's Imran Matin, who's from the BRAC Institute of Governance and Development, and he's talking about Bangladesh and COVID-19 reversals and resilience. Next, we have Adrian De Giovanni from the International Development Research Centre, representing the authors of the articles, but was very central to the focus of the paper, which was about positioning research for impact, lessons from a funder during the COVID-19 pandemic. We have Orzala Nemat, who's from the Afghanistan Research and Evaluation Unit. She's talking about livelihoods and welfare amidst layers crisis in Afghanistan. Then we have Kate Lines from the Global Development Institute, University of Manchester, who's talking about COVID-19 vaccine rollout, the challenges and insights from informal settlements. Vanessa van der Bogen from University of Toronto, the distances that COVID-19 pandemic magnified, research and informality in the state. There are two more, bear with me. There's Morgan, who we're here in person, of course, from the London School of Hygiene and Tropical Medicine, who's talking about adapting disability research methods and practices during the COVID-19 pandemic. And this is experiences from the field. And then last but not least, we have Andrea Ordonez from Southern Voice, who's talking about the COVID-19 pandemic as an opportunity for leveraging Global South research and knowledge. So we have a fantastic panel, and I will hand over now to Imran.
Great, thank you very much. Can you hear me? Can you hear me okay?
Yes, yep, we can hear you.
Okay, all right, great, thank you. Great, so as you know, I mean, so the paper that we contributed to this IDS Bulletin is really the Bangladesh case, but really focusing on, you know, on the impact of COVID on livelihood and trying to understand coping mechanisms and the sort of overall recovery dynamics. We basically, it's a partnership with PPRC, which is another research organization in Bangladesh. We came together right at the beginning of COVID, and you know, in April 2020, and we decided to use our respective strengths to really come together and provide what we call rapid, reliable evidence to influence and inform public discourse around COVID. So that was the stated objective. PPRC, you know, brought primarily their deep understanding of public discourse and policy dynamics, and BIGD as a applied social science research institute, we sort of brought in you know, our large scale national database, phone contact points, you know, kind of resources that we had, and we sort of came together, and we sort of over the last 2 years We have done 5 rounds of survey of about 5,000 or over 5,000 households. So we've got quite a rich panel data that can help us look at things in a more dynamic way. So just a few highlights. I don't think we have a lot of time. There are a lot of speakers. We want to hear from everyone. So what are some of the key reflections or findings that we find? So one is the importance, and I think this is sort of quite general. I'm sure it'll be echoed. The fragility, the precarity of the urban sector. And I think that came across extremely strongly across our different surveys. So, not only the initial impact was much more intense for the urban informal sector, but the recovery for the urban informal sector was also much more sluggish compared to the agriculture sector, the rural agriculture sector. So I think that has got very important implications for social protection thinking, where urban social protection generally, is not as central to the social protection discussion, and in many cases, it's actually not even thought about. It's urban poverty seen as a transitory problem, as a problem that basically should be resolved by incentivizing people to go back to villages. So the urban face of COVID, I think, is sort of extremely clear. The other dimension of the urban impact is the mechanisms through which the impact basically affected urban informal sector is not only through the direct effect of losing income, but also through the indirect effect of increasing non-food expenditure. And I think that's really important. And there, the increase in the non-food expenditure is primarily around transport, around house rent, around variables, around expenditure items, which is extremely related with governance, sort of ultimately with urban governance. And this sort of draws attention to the importance of thinking about urban social protection, in a much more connected way, because urban livelihoods are far more kind of complex. They rely on transport, on rent, on housing, mobility and insecurities, which are again very much linked up as a important governance problem. So I think that is a very important dimension. The second is the fact that women, and again, this is much more of an urban phenomenon, because most of the employment is primarily urban in the sort of Bangladesh context. In the rural context, it's sort of urban, rural female employment is sort of much less sort of prominent. So the return back to work has been really weak. At least in the 5 rounds that we have basically seen. Maybe subsequent rounds may sort of paint a different picture, but we basically saw the return back to employment has been much more difficult for women who were employed pre-COVID, right? And this is another facet of the urban vulnerability, if you like. And the last one, I think, is sort of really around this whole kind of what we call new poor. And this is basically people who hover around the poverty line, who sort of normally are non-poor. We defined it as people who are above the poverty line and below the median income, national income of the country. This has been more sophisticatedly developed now by the World Bank. I've been seeing reports there, but this whole notion of large number of people who hover around the poverty line. Largely non-poor, but they do dip in and out of poverty as well, but they're largely above the poverty line. The precarity of this whole group, which is actually constitutes what we call the progress against poverty that has happened, which basically makes any shock such as COVID kind of so severe And of course, I mean, one should also realize that it's not only the COVID shock that has happened in terms of its primary and secondary impact, but also the repeated shock that has happened since COVID. At least in Bangladesh, there was a cyclone during COVID period, and then there was a flood, and then there was the price hike, and then of course the sort of recent global crisis as well. So I think there's a whole notion of kind of how do multiple crises basically layer on each other and the kind of impact it basically creates. And we looked at the new poor, and so we tried to do a national estimate of new poor. So right at the beginning, we saw about 21% people of Bangladesh overall nationally became new poor, who were not poor before COVID but became new poor right in June 2020. Now by May 2022, this was 18.5%. And again, this sort of kept on moving up and down, but I think because of the multiple shocks, we did not see a kind of a huge, kind of an improvement or bouncing back. It's sort of merely 21 to 18, 2 to 3%. Over this last 2 years, we see progress in terms of recovery. Out of people who were new poor being able to sort of move out of the new poverty status. Now, in terms of, I'll sort of finish, but in terms of, I think three concepts, I just want to complete with sort of that and leave you with three sort of ideas or sort of thoughts. So one is, this whole notion of distress resilience. This is something that we sort of talk a lot about in our paper. So there is resilience, and I think there is a I think there's a need to really critically examine resilience. And what is the cost of the resilience? So this is not only a negative coping mechanism, it's sort of the resilience itself is extremely distressed. So it's not severely negative coping mechanisms like we basically see at big asset sales and things like that. In this case, it has been the precarity of the resilience, right? So the resilience that we see is extremely distressed. So I think that's sort of the first notion, which I think needs to be unpacked more. And I think this has got some sort of currency in terms of thinking about social protection. The second is the unfair bargain, right? I mean, we sort of keep on sort of seeing that the government stimulus package systematically fails to address informal workers, systematically fails to support small and medium enterprises. They tend to be much more focused and successful in terms of relatively successful in terms of protecting RMG sector workers, we see that, or transport sector workers, the organized labor. So there's something about organized sectors and organized labor versus informal sector, informal labor, right? In terms of how the politics of response, right? Government response.
We might have to wrap up in a minute, just another minute.
Sure, absolutely. So I think there's this, and related to this whole area that I just mentioned, which is really around the non-food expenditure, which is again tied up with the fact that the sort of the total kind of non-responsiveness to sort of address some of the rising non-food expenditure around rent and around transportation costs, which sort of severely affected urban poor, right? So there's this unfair bargain. So you basically are, people are left to their own devices to be able to live themselves out and sort of, face a situation of distress resilience. So there's two notions of unfair bargain and distress resilience are the sort of two concepts that I think we need to think through more seriously, and has got implications in the way we design and think about social protection, responses to such crises. I'll stop there. Thank you very much.
Thank you very much, Imran. That was very informative. And now I'll hand over to Adrian De Giovanni from International Development Research Center.
Hi, everyone. It's wonderful to be speaking with you today. I'm calling in from Ottawa, Canada, and a custom that we've had in recent years is to acknowledge the lands that we are sitting on. In case of Ottawa, they're lands of the Indigenous people, the Algonquin and Anishinaabeg people. So these are lands that are unceded, we say, they're unsurrendered. Some of them governed by treaty that go back to Queen Victoria. And we're just coming up on Friday on a second National Day of Truth and Reconciliation with our Indigenous people. And it's been an interesting past couple of years because, as you know, debates have raged in the development space, especially academic ones, on decolonizing knowledge. We've also been brought to reflect on decolonizing the aid system. We've been brought to reflect on our own experiences as a Canadian institution with, like it or not, there's a colonial legacy to all the Canadian public institutions. So just to flag that there, that's front of mind in the part of the world where I'm sitting. And so today I'm stepping in for two colleagues, authors, Arian Dahan and Anna Sanchez-Warren, who couldn't make it today. And they did a reflection on a large COVID response initiative that we started to fund right as the pandemic hit. It's called COVID Responses for Equity, CORE. And it's 21 large projects in 42 countries, which in Canadian dollars is 25 million. Don't know what that is in the pound sterling at this rate. I hear it's been fluctuating. And so, sorry, just ripped from the headlines. But all to say, at the time, it was our biggest single response. And that was really a function of timing. April 1st is when we start funding new projects on a year. The pandemic hit mid-March, and there was a decision for the institution. We kind of scrapped our plans and said, how can we respond to COVID? And through really largely on the social science support. There was already initiatives on health, agriculture, and so this was a big bet. And so at the time, it felt quite unscripted, and we were just making decisions on the fly. A couple of years later, looking back, actually we followed a very familiar script that IDRC tends to follow. For those of you who don't know us, we're part of Canada's Development Assistance. We have an over 50-year history. Really, we fund research and researchers in the global south, so local voices. And it's been a model for a number of decades, really on the bet that when research and policy solutions emerge from local voices, local actors, they're more likely to have impact, policy uptake, call it what you want. And so at the time, we decided really to fall back on an existing network, largely of partners that we'd worked with before, and we gave quite flexible funding and grants around $1 million Canadian to, again, it's about 21 organizations, a bit more, many multi-country projects, and it was really on a few broad themes around macroeconomic support. What's the impacts? What are solutions in the face of the pandemic? Because at the time, countries were really making large surge support. Also on social protection, and then on governance and the governance of the response and just impacts of COVID on governance. And so a couple of years out, what we've seen is that a few things really worked well. So one is that, again, we worked with large organizations, existing partners, and among colleagues at the time, that was quite a, I would say, debated choice. We could have gone in many directions. One would have been to top up existing projects to be very operational. Another would have been to really just try to be experimental and see what we could do. But what we were trying to do, one, is manage risks of no one quite knew what it would mean to launch new projects at that beginning of the pandemic. Now we know quite well. But also trying to do it rapid time. And within 2-3 months, we had launched a whole series of projects. It was a quite productive time, if you want, while we were all sitting in our living rooms and basements for the first time, just to bring us back a couple of years. And so the flexibility worked, an existing set of partners. And then also really what it showed us then, and so in the article, just to bring us back, and sorry, now you've seen I'm a bit too unscripted, there is really a dearth of research funding in the development assistance to Southern think tanks, research institutions, especially on social sciences. And so this was really an attempt to inject that, which we did. But alongside that, the flexibility, we couldn't predict what questions really fully to ask in which countries. And so we kind of had more sketches of project proposals than we would have, sort of making bets on directions, which were then refined as we went. And so really what it has showed to us then over the last couple of years is the importance of resilience. And I know Imran mentioned that point in a slightly different context at the end of his remarks, but resilience of research ecosystem and research institutions. What made that possible was long-standing and pre-existing investments in think tanks, largely through an initiative we had hosted over a number of years called the Think Tank Initiative. which Peter Taylor was deeply involved with at the time. And it's really to show, because there was that existing capacity, we could respond in a surge way. And I think that's an important element to think about for funding research going forward, making those long-term multi-year investments, which are not glamorous and they're actually hard to make the case for. And so then finally, a couple of things. Thanks to some work by the COVID Collective, or is it the COVID Circle, they have looked at which initiatives have been able to have policy influence or uptake since, and it seems like we fared well with CORE. In some sense, for a very obvious point, if you invest in policy-oriented research with partners invested in policy environments in their countries, they do tend to have some influence. And that seems to have worked well in this case, but that also goes back to the resilience of a system where you have actors who are already thinking about policy, able to position research well within it. And then a final point, we took this as an opportunity, since we had this huge number of projects, to experiment, at least for our purposes, a bit with knowledge translation. And so we had invited IDS at the time to help us think about and now support over this vast body of knowledge, many projects, many regions, really trying to make the links between partners, sharing knowledge across projects and countries, and also now as research is emerging, helping us position and think about positioning and telling good stories about that. So there is a larger learning journey alongside the article that you read, which goes more in depth than some of the points I've been talking about, and also some stories of impact. And just to say, we really didn't know, because research can be a slow boil. And at the time in May 2020, everyone was reacting quickly. And we think now what's paid off, although we had to kind of hold our breath and push back, people saying, where's the results, where's the result? Now the pandemic is over, we've been saying, but the building back and the recovery is going to be with us for many years. And so we've been waiting for this moment to actually ensure that we have a good body of evidence to guide policy discussions that may not be framed in terms of the pandemic anymore, but still are definitely shaped by. And then just the last point, I normally in my own work, I work on issues I would sit in a democratic and inclusive governance team. We're really thinking about democratic backsliding. I worry about issues of grassroots justice and human rights. At the time of our response, there wasn't quite the same established infrastructure or institutional strength of organizations where you could easily go to and say, here's some flexible, unstructured funds, run with it. And so what we've done in the past couple of years on a series of governance issues is really think about building up that resilience over time, because the crises of public governance and human rights and democracy seem to only be growing as other crises are colliding, just to, again, echo Imran on the colliding crises. So thank you. I hope I stayed relatively within time, and it's a pleasure to be here.
Thank you very much, Adrian. Very good to hear from you. Now let's move to Orzala Nemat from Afghanistan Research and Evaluation Unit.
Thank you very much. Can you hear me well?
Yep, we can hear you.
Perfect. Thank you. For us in Afghanistan, this project was also coming in a very interesting time. So ARU, or Afghanistan Research Evaluation Unit, became a member of the consortium in a time where Afghanistan context was characterized by the most intense level of conflict, the most unprecedented by that time. This was during 2019 to 2020, the 2020 and 21 period. Also, the context was characterized by a continuing 4 years continuing droughts that was affecting people's livelihoods. And at the same time, as we move on with the partnership and with the project research, we also experienced the even more dramatic change of a regime, sort of a collapse of one regime or establishment of a new, completely different one. So within this context, to partner, I will take just this brief time in the panel to have some general reflections. One, in terms of the context intensity, we highlighted in this paper in the journal mostly the methodological aspect of the work that we did. So for us in Afghanistan, it means a lot. It meant a lot of adaptability and the sense of ensuring that, and not to forget, obviously, the pandemic that was also a factor that I just missed to mention when we were talking about the context. So the global pandemic, the number of affected people by COVID, by the time when we were doing the research, and the restrictions, the movement restrictions, the access and everything was nearly similar to the rest of the countries. So within this context, deciding to continue to do research and continue to produce knowledge was obviously requiring adaptability and requiring sort of a very sort of, I can say, thorough looking into the approaches and methodologies that had to be used. And so what happened at the organization level at ARU was to ensure that our general or our sort of traditional security assessment tool that we use in terms of the physical security of our researchers visiting the field, but also our basically informants, those who are informing us and providing us with interviews, we decided that the first early stages to ensure that this overall assessment is also including health factors and specifically addressing the issue of COVID and what are the sort of key criteria to assess, for example, where to, in terms of the numbers that were reported. We had issues of reporting obviously everywhere on the COVID situation, but ensuring that health becomes part of the security and overall assessment, and particularly in terms of the COVID-19 health situation. So that was one aspect of the changes and the actions that we've taken. Secondly, in general, we had selected most of the other collective members, we had also selected sites that we identified based on set criteria for conducting the research and the study. And in that area, the whole context or the dynamics of the context in the time that we were conducting research meant that we had to show a level of flexibility and adaptability in the sense of locations within the sites or prioritization of the sites based on the rapidly changing environment. So unfortunately, out of the 3 sites we have selected, we only were able to cover at the end 2 of them. So one completely gone off because of the whole regime change and lack of access to the field and the change of the situation. But within the 2 others, we were able to sort of apply sort of more innovative ways of ensuring that the researchers are completely sort of bounding themselves with the research ethics, ensuring all the privacy, the confidentiality and consent and everything, and B, also maximize their own safety and the safety of those they are speaking to and they are receiving interviews from. So that meant also some level of mobility, meaning in one cases, informants visiting within the site, visiting one center where the researchers were, in other cases, changing the location. All these things were sort of necessary in terms of ensuring that this project and this assignment was completed in an effective way. So now, in the paper, we also discussed about the characterization of the 2 specific provincial sites, what characterizes them within the context and the time when the research happened. And that also helped us in terms of going specifically and looking into how the pandemic specifically affected the livelihoods of the people. And to go a little in details in terms of, how and who were the mostly affected groups of people that were identified based on the research, we found that it was generally the poorest of the poor households, those households who were displaced, and also the migrant workers. The study in itself highlighted how these sort of rapidly changing situation has really affected these particular groups worse than any other groups. Obviously, when we go deeper into the data and sort of unpacking this different aspects and dimensions in terms of the age groups, we also highlighted in our study how the young adults were more affected than other groups within these families and within these communities. And when we talk about migrant workers, it's generally the young adults, so young male adults to be very specific. And the study is also sort of highlighting in terms of the core of the livelihoods of people in these households from different backgrounds, different aspects from the situations where we noticed and we observed from the data about the restrictions on the jobs and job market, to the closures of the borders and sort of losing access to the markets, to the local sort of people, local traders and vendors, and even local migrant workers or those who displaced from their own households to nearby areas, how their access was sort of affected. And finally, how this whole situation also resulted in further displacement of families and people. And what we try to highlight here is that the context became more and more complex with the climate changes, very intense level of drought, and the conflict that was intensified, and also the COVID that's all combined together. So the study in Afghanistan, what I can say just as a summary, was happening in a time where we were just at the beginning of a very massive change in the situation. And of course, at the later stage, the changes also emerged, and we try to cover it within, the context of this project and beyond it, to see how these changes are sort of providing us with some contextual understanding of things that existed just before this massive regime change and the consequences with the aftermaths with the further limitations to people's livelihoods, development assistance completely being closed, and of course the drought continuing and so forth. Finally, in terms of the policy implications, what we try to highlight in this whole study was that, in context like intense conflict context, like the one in Afghanistan, the situation is rapidly changing, and that requires the policymakers, the program designers and implementers to catch up with this rapid changes in terms of coordinating or creating more coherence in the data collection processes. It also sort of highlights the point or the importance of the humanitarian assistance providers to address and to sort of make note of these changing dynamics and addressing the needs of every community in a very specific way, whether they are displaced people or migrant workers, and to look at all of them just as those who are in need of daily food rations is not really an effective approach. And so that requires to be sort of re-looked at. And finally, sort of the importance of continuing studies and research on the issue of livelihoods and how they change and these intense situations is something that we recommend, and we hope that we will be able to continue this line of study as we move on. So I conclude my remarks here, and hopefully will be chances to hear more and to have further discussions on the Q&A part. Thank you.
Brilliant. Thank you very much, Orzala. Now let's move on to Kate Lines from the Global Development Institute at the University of Manchester.
Hello, can you hear me?
Yep, yes, we can hear you.
Great, thanks. Okay, hi. Thank you for having me today, and thanks IDS for putting on the event. It's great to be here. Yeah, so my name is Kate Lines. I'm an independent research consultant, and I work at the moment with the African Cities Research Consortium, or ACRC, which is led from the University of Manchester in the UK. And the paper that I'm introducing frames the issues and discusses some of the early findings from a study from Harare, Kampala, Lilongwe, and Mumbai, with research carried out by affiliates of Slum Dwellers International in each of these cities. And for those who don't know, Slum Dwellers International, or SDI, is a global network of national and local federations of informal settlement residents and urban poor people. So we wanted to explore in the study how the global vaccine inequalities, of which I'm sure many people are aware, were playing out at the local level by looking at the grassroots perspectives on the COVID-19 vaccine rollout. And our specific focus was on the experience of residents living in 21 informal settlements across these 4 cities, Harare, Lilongwe, Mumbai, and Kampala. And in each settlement, we spoke to the same 15 community leaders every 2 weeks over the course of 3 months to find out their perspectives, their own perspectives, and what they knew about the situation that was going on in their communities. And here we've defined community leaders very broadly. So we spoke to people who were involved in settlement governance, religious leaders, youth leaders, and also to community health workers. So our aim was to talk to people who could be reasonably expected to know what the situation was in their communities. The data collection, like I said, took place over 3 months. So towards the end of 2021, and the IDS Bulletin paper was written when we'd only started to analyze our first tranches of data. So the focus is on framing the issues and presenting a little of what we were beginning to find. And the full data findings will be published next month on the ACRC website, as well as a paper in the journal Environment and Urbanization next year. So if you're interested, then please keep an eye out for them. And I'm also going to put a link in the chat to a short grassroots documentary film that we produced as part of the study. There we go. Which was done by SDI's Youth Media Collective, which is known as Know Your City TV. Okay, so I've tried to think about a few key findings to share today that link to the paper and the theme of this event. And before I do, I just want to reiterate the numbers. So as of this morning, 23% of the populations of low-income countries have had 1 or more COVID-19 vaccine doses, and that's 63% for lower middle-income countries. But this compares to over 80% of the populations of upper middle-income countries and high-income countries, and many of those have also obviously run onto booster programs now, including Denmark, the country I live in. So while much of the world has opened up and to some extent moved on in the face of many other crises from the coronavirus pandemic, we do still sit in a flawed status quo that it's threatened by the possibility of new variants. And these are most likely to emerge in contexts of high rates of infection and low rates of vaccination. All right, just to come back to the study, what we wanted to know about was what the COVID vaccination looked like from the perspective of informal settlement communities, where people were going to get vaccinated, whether second doses were available, did people have to pay at the point of service, were there alternatives, either legal or illegal alternative means to access the vaccines, and how was the accessibility and the availability of vaccines to people living in these communities. We also asked about people's attitudes towards the vaccine and the level and the nature of vaccine hesitancy, both the survey respondents and also what they knew of people in their community who were particularly hesitant. Were there any particular groups? What were their motivations? And we asked whether informal settlement communities were getting the information that they needed about vaccines and vaccination in the opinion of the survey respondents. And then we also tried to find out a little bit about the broader context. So the COVID health context in the study locations in and the longer term economic consequences that the pandemic control measures like lockdowns and curfews and demolitions had on informal settlement communities and informal workers. So I'm not going to go into depth about our findings. I just wanted to flag three points that I thought were interesting. First, and perhaps this is quite obvious, many of the reasons that vaccinations can be hard to access for people in our study communities in informal settlements can be linked to low national stocks. And in this way, directly back to global vaccine inequalities. Our study took place when I think it's fair to say that now things have eased slightly in terms of global vaccine inequalities, but when our study took place, things were definitely very bad. Countries were getting very few supplies. Some of them, I should say, because India was part of our study, and so was Zimbabwe, and both of them had quite good supply. So, so we had that contrast. So anyway, so for example, in Lilongwe and Kampala, where the governments were very reliant on the COVAX program, the overall lack of availability meant that vaccine centers couldn't vaccinate every day, or they had to limit doses, or it meant that centers just couldn't be brought near to where communities live, and informal settlement communities already lacking adequate healthcare facilities were particularly likely to suffer. The second point was that poor availability and poor accessibility can inflame vaccine hesitancy for a number of reasons. Availability was poor in Mumbai and then improved a lot. And the reflections that we heard from people were that if you don't know anyone who has been vaccinated, you're much more likely to believe misinformation about wildly adverse side effects, or if it's going to cost a lot of time or money or lost earnings to travel and queue for a long time to get vaccinated, then people are more likely to put it off. And men and women, we also found, face different motivations and barriers to get vaccinated. Some common across the cities relating to women's care responsibilities, and some were much more context dependent, depending on the gendered livelihood strategies of different communities and the pressures they place on people to get vaccinated or not. So lastly, I wanted to flag the issue of vaccine requirements or mandates, for example, to attend work or church, or trade as a market vendor, or travel on public transport. And these can be a real challenge to informal settlement residents or communities where vaccines are not available. So that's just to finish up.
Okay, thank you.
Sorry, I'm going over a little bit. Yeah, so I just wanted to say that the SDI affiliates experiences that older citizens and many people with underlying health conditions in informal settlements are still very nervous about COVID outbreaks. And lots of young people might now have shifted their focus to the cost of living crisis and the socio-economic challenges compounded by the pandemic, but everyone is still aware of the ongoing threat of further state responses and shutdowns, the results of which in informal settlements in these communities have already been very serious. And I'll stop there. Thank you.
Thank you very much, Kate. And maybe just remind the final three speakers to try and keep a little bit more to time. I've been bad on the time management, I'm afraid. So the next speaker is Vanessa van den Bogard from the University of Toronto.
Great. Thank you so much. It's been really fascinating already to hear from the other panelists and their experience. So really happy to be here today. I'm going to talk about a project that was undertaken with a team from the IDS Governance Cluster, as well as a team from the Lahore University of Management Sciences. It's part of a broader project that we undertook throughout the pandemic to capture the experience of informal workers in the city, in the urban context of Lahore, aiming first to understand how the virus and associated lockdowns affected informal workers, things like whether they were able to access pandemic reliefs, whether the experience of getting relief or not influenced their willingness to get vaccinated, and also then to understand heterogeneity in these experiences, both across sectors as well as genders. Now, as some of the panelists have already noted, I think it was Imran noted that informal workers in many contexts across the globe have been significantly affected by the coronavirus and the associated lockdowns. But at the same time, we know that the voices and experiences of informal workers during the pandemic, have often been excluded from common research approaches. So, for instance, I think we all know here, phone surveys became a particularly common tool used by researchers throughout the pandemic. But they are also particularly likely to exclude low-income populations and certain types of informal workers in particular, including those that work in less visible spaces or may have less well organized in labor unions or associations. So we approached this project knowing that it was critical to capture the experiences of informal workers to come to a more complete understanding of the impacts of the pandemic and the policy implications of the pandemic, but also recognize that there would be challenges in doing so. So we were also then motivated to write this paper for the bulletin as we reflected on some of these challenges and the broader challenges of doing research related to informality. In the paper, we highlight 3 types of distances that we argue were magnified throughout the pandemic, and discuss some of the strategies we use to undertake to pursue our research despite these distances and some of the new challenges related to the pandemic. So I'll just go through those in turn. So first, we identified a spatial distance. So this is the most obvious one, increased distance between researchers and respondents, obviously with social distancing requirements and some of the ethical considerations of ensuring the health and safety of both researchers and research participants. Now, as I noted, phone surveys became the default for many research projects throughout the pandemic, and indeed for ourselves, given the challenges, we had originally considered undertaking remote data collection through phone interviews. But in the piloting phase of our project, we quickly realized that phone surveys both wouldn't allow us the substantive depth that we wanted within our qualitative approach and would exclude some of the most vulnerable groups of informal workers. And that was really our biggest fear. So we knew, again, that the poorest didn't have access to technology, that women were less likely to answer phone calls, to talk to us, and that certain types of informal workers, including domestic workers, those working in home-based manufacturing, were less easy to identify, less easy to capture in this way. So we did end up undertaking in-person interviews. As I'm sure many people here can relate, that it was challenging in many ways. Caused a lot of delays in the project as we had to wait for periods when viral transmission was low in the city, when local restrictions eased. So there were lots of starts and stops to the research. I think really emphasizing a theme that is probably common across these research projects, the need for flexibility, both among the research team, but I think also on the part of our partners, including our local CSOs that we worked with, as well as among the funders. In addition to this flexibility, we really emphasize the need to work closely with civil society actors in order to gain access to respondents, and made extra efforts to interact with respondents in public spaces, again, using civil society partners to identify some of those public safe spaces. The second distance that we highlight is a conceptual one between theoretical concepts and the everyday ways in which expression and language are experienced and communicated by informal workers. An example here is that in our initial interview guides, it became quite clear that we had incorporated some assumptions about the importance of the state in people's everyday lives in a way that just didn't resonate with the informal workers that we were talking to, particularly given that their engagement with the state was often even lower than normal during the pandemic. So we took extra time to pilot and implement interviews to ensure that interview questions were grounded in the lived realities of research participants. Again, we worked closely with local civil society partners and key informants to help us understand the changing role of the state in the lives of informal workers. And within our research approach, we allowed space for respondents to sketch an image of the state rather than it being influenced by our own preconceived notions. Now, the final distance that we highlight in the paper is an ethical one that we, a tension that we saw between our role in research and advocacy, which was really highlighted by the question of what to do when researchers were confronted with misinformation while interviewing informal workers. And this was a common experience we had when talking with respondents about trust in the state, about vaccines. Respondents would often share rumors and conspiracy theories that they had heard about the vaccine. On the one hand, we reflected on our duty to correct misinformation when there were health outcomes at stake. But on the other hand, it also raised questions for us about our role as neutral observers versus policy advocates, and certainly recognizing, of course, that we're not medical professionals equipped to provide advice. So after kind of much reflection and discussion, what we ended up doing was ensuring that after going through our standard interview guide, we would always then open a discussion with respondents about misinformation about the vaccine, including sharing public health guidelines and sources of public information, while also being open and responding honestly to interviewees when they had questions about our own decisions to get vaccinated. Now, just to wrap up quickly, none of the challenges or the strategies that we undertook that we discuss in this paper are particularly novel. I know I don't think we purport to have solved any of the underlying challenges of doing research during a pandemic or in relation to informality. But we do hope that by sharing our experiences, we can offer other researchers a look at what was possible, what went wrong, what worked in this context, and to steadily make a case that qualitative work still remains possible, even in the context of the pandemic. We believe that it can actually be really important to ensuring that certain groups are not excluded from research projects. And at the same time, within the paper, we reflect openly about the limitations of our research approach and adaptations. We hope that can open a conversation here with other researchers about the real challenges and ethics of doing research during the pandemic, particularly with vulnerable groups like informal workers. So thank you very much. I will leave it there.
Thank you very much, Vanessa. Morgan Banks from London School of Hygiene and Tropical Medicine.
Is there a way to turn this off?
You can use this.
Oh, perfect. Okay. Perfect. Hi, everyone. So today I'm going to be speaking about adapting disability research methods and practices during COVID-19. I think the presentation follows well from Vanessa's looking at some of the challenges of conducting research during this time for particular groups. Before going on, I'd just like to acknowledge that the paper and the underlying lessons were the result of a collaboration with multiple researchers in multiple countries, including the UK, South Africa, Ghana, Bangladesh, Zambia, Turkey, and India. So it was the result of studies across 10 countries in Africa, Asia, and Europe. So we really benefited from a wealth of experience from different researchers. To set the scene, even before COVID-19, people with disabilities have often been underrepresented in research. Then, as we all know, COVID-19 has brought about additional disruptions to how research is conducted and how people with disabilities are included in that research. And it's very important going forward as we enter different phases of the pandemic that any new types of innovations that we have to data collection are capturing accurately the voices and experiences of people with disabilities so that those concerns are reflected in policy and practice. So from the experience that we had in these different research studies, there were different considerations for adapting methods and practices to be disability inclusive. So this involved decision-making on proceeding with remote data collection versus in person. For remote data collection, thinking about the platforms that were used, as well as any implications for recruitment and how to support participation. There were also some considerations related to the topics that were covered, particularly for sensitive topics, and then also how to have inclusive and effective analysis and dissemination. So if I start first by looking at the decision to proceed with remote versus in-person data collection, so there was often a balance in this case, and this continues going forward. So first and foremost, the consideration was the safety of participants and the research team. And it is important to acknowledge that some people with disabilities do have a heightened risk of poor health outcomes from COVID-19. So for example, in the UK, in the period before vaccines were widely available, people with learning disabilities were, I believe it was 5 times more likely to be hospitalized and 8 times more likely to die from COVID-19. So there are often quite staggering differences in risks. And then there was also the consideration around feasibility. So whether people had access to required technology and whether we were able to provide suitable accommodations with that technology. So looking a little bit at technology, one thing that's important to note is that access to mobile phones and internet is generally lower amongst people with disabilities. So here we have data from the UK, which is from 2019, and it found that about 23% of people with disabilities did not use the internet compared to around 6% of people without disabilities. So there is this digital divide in terms of access to technology, which is reflected in many countries. Additionally, in many of the countries where data was collected, access to smartphones, internet was less regular or less widespread. And some of these forms of technology, this video-based communication, was important for people that required, for example, lip reading or sign language interpretation. So being able to provide those accommodations with remote data collection could be challenging. On the flip side, it is important to note that remote data collection could reduce barriers for certain people with disabilities. So it meant that some people didn't have to travel for an interview, and they also had more control over the privacy of their homes for in-person visits. There were also implications for recruitment. So during the pandemic, during periods where there were heavy restrictions, it was not possible to do, for example, door-to-door recruitment. And so there was a reliance on recruitment through organizations such as NGOs or organizations of persons with disabilities, which had pros and cons. They could help facilitate access to required technology, but often people associated with these organizations may not be reflective of the broader population of people with disabilities. On the plus side, remote data collection can expand the geographic reach of a project much more cheaply than if people needed to travel in person for data collection. There was also a need to rethink some of the adaptations that were needed to support people with disabilities in being able to share their experiences directly. So as we move forward to more communications with Zoom and other video-based platforms, there is a need to adapt some guidelines. So one participant in the UK with dementia, for example, produced some guidelines on how to use Zoom meetings for people with dementia, with focuses on appropriate backgrounds and sort of length of meetings. So more of that is helpful. And also thinking through how to provide adaptations if people didn't have access to required technology. So here there was some positive examples of, for example, organizations facilitating access, but this was not widespread. And in general, advanced planning is always the most helpful. So asking about accessibility requirements in advance. There were also certain challenges with remote data collection on confidentiality, particularly if people were in close living quarters, and how to be able to talk about sensitive topics, as well as ensuring referrals. So as part of the ethics for many research projects, if people disclose particularly troubling circumstances, there is a requirement to be able to offer referrals. But this was more challenging during COVID-19 when many of these services shifted to formats that were either not available or not always accessible and disability inclusive. Then finally, looking at strategies for effective analysis and dissemination. So being very clear about some of the limitations given the setting, whether that was a sample that had to have access to required technology or was recruited more through organizations. And then looking at modes of dissemination. So online formats might be preferable for some people with disabilities, but it could leave others behind. So again, going back to that digital divide. And then also thinking as more products are disseminated online, there can be concerns for safety. If people with disabilities, for example, are sharing their experience directly, there's less control over who is accessing that information. So just a few reflections moving forward. So COVID-19 is likely here to stay, and that has pushed many of us into new ways of working. So remote and hybrid ways of working are likely here to stay. They seem to be the new mainstay, as we could see from today. But it is important to consider ways in which we ensure that people with disabilities are not left behind. So whether that is formalizing best practices for inclusion in some of these remote platforms, as well as strategies to reduce this digital divide so that people with disabilities can participate in the research process. Thanks very much.
Thank you, Morgan. And to our last speaker for today from the panel, Andrea Ordonez from Southern Voice.
Thank you, Paul, and hello, everybody. I have the nasty job of finishing the panel, but it's been a great panel, so I really don't have to add much. So I'm with Southern Voice, a network of think tanks across Africa, Asia, and Latin America. And how we saw the experience of COVID was of seeing it as an opportunity to test some of our working hypotheses for having a network of think tanks across the Global South, which is that the perspectives from organizations based across these regions can be really valuable at the global level. And, you know, the COVID gave us a natural experiment to kind of test that hypothesis. And based on the experiences from our members, what we've seen is that changes on both sides of the knowledge producers, of the research centers and think tanks across the Global South, and also of the demand for knowledge from, particularly in our case, our interest from global level policymakers, decision makers, and other researchers and you know, opinion generators from the global north. So in terms of the researchers, what we see and exemplify in the paper are examples of how these organizations were able to exert more leadership in the way that they implemented their responses to COVID. And I won't go into detail on examples, but that's how we've encompassed what we see in a lot of the cases from the organizations that are part of our network. And we also saw a change in the demand for these perspectives from the Global South. While, you know, in the before the pandemic, we had to do a lot of knocking to showcase the relevance of research coming from the Global South. Maybe for the first time, we were consistently getting more calls to, you know, we want to talk to someone in this other country. We want to learn more about how response is going here and so on. So it just, it created that opportunity to listen to these voices and create that demand for knowledge that was not there before. So I think that our main point of producing this paper and bringing these reflections forward was to show how, you know, this situation of COVID allowed us to do things differently, and that some of those things would be worth us reflecting and keeping moving forward. We have this tendency within the research policy community to think that when we are producing, that when actors at the local level, Southern think tanks or research organizations are producing knowledge, that is only relevant at the local level. And so we put this label already to knowledge being only valuable at the local level. And then when an organization based in the global north, usually labeled as a global organization, does similar research, then it's global and the lessons can be applicable everywhere. And this is, this is something that's very ingrained in our way of seeing research in development, not only in actors in the global north, it's embedded in all of us. It was clearly embedded in how I learned to do research myself. But I think COVID was precisely that moment of experimenting with these and with having something hit everybody at the same time. It really put forward the opportunity to say, there is an opportunity for us to learn from each other. There are opportunities for the global north to learn from the global south, and vice versa. And solutions and ideas can come from all these different settings. So our idea of bringing in some of these perspectives of the differences that we see because of COVID was really to invite us to think how some of these things could stay after the pandemic. Thank you.
Brilliant, thanks, Andrea. And actually, I think it's fair to say that there's quite a number of research collaborations and partnerships which are being discussed, which are embedding many of the things which have been learned through these processes going forward. So thank you from me to all of our panelists. I mean, I realize we've had a lot of talking, but we wanted to really ensure that each contributor to the bulletin for each paper was represented, so you get a flavor of what's there. And obviously, we really hope that you're going to go and read the bulletin, which is open access online, and you'll be able to access it and read it all in detail. We just wanted to have a few quick reflections also from Tim Conway. Tim is a senior social science development advisor at UK's Foreign and Commonwealth Development Office, and the Research and Evidence Division has been extremely supportive to the COVID Collective throughout. And Tim, particularly individually, has been incredibly supportive. And really, it's with that financial support that's enabled all of this research to be carried out. So Tim, could I just invite you to share a few quick reflections?
That's great. So thank you very much, Peter, and thank you to everybody for talking today. An incredibly rich collection. I'm aware we're short of time, so I'll sort of jump straight in. I think a lot of this resonates with challenges that we feel as a global funder of research relating to development. I think we recognize that this is a huge setback in terms of countries' progress to prosperity and better human development, and we do need ways of picking up on this quickly and getting the right information, the right analysis to actors at all levels, from community up through global institutions. I think it reveals the importance of we talk about the importance of longitudinal analysis, and I think we need to recognize that having local voices, local actors, local analysts involved really matters, because a lot of the things that drive change between rounds of data collection are things that are quite nuanced and that actually require people on the ground to pick up on what might explain change from one round to another. So I think this has really picked that up, and that came out very nicely in several of the papers. I think it is a challenge to think about how we all support more equitable research partnerships, and trying to get away from the language of building Southern research capacity, which is a little bit crude, but how do we build more equitable, more productive, more effective research partnerships? The trouble is, a lot of donors are quite have shifted over time to becoming more transactional. There was a time when we would fund universities in low and middle income countries, and that would be a long-term commitment, and I think quite a few have retreated from that, and I think that is a little bit problematic. There tends to be a focus of donor-funded research on social science research on what can give us actionable lessons for practice that is relatively generalizable, relatively reproducible and we can feed back into our own bilateral programming a lot of the time. So, that is understandable, lots of pressures for showing value for taxpayers and those kind of things. But I think we need to recognize that we also have to create space. We have to safeguard some funding for those long-term investments in building, the capacity for more equitable, more Southern-led views on what the nature of the problems are and what works. I think things also get a bit complicated because when we try to do this, we often end up finding that certain countries actually are quite good. So a lot of the time we say we're doing quite well in building more equitable partnerships, and we have partners from South Africa, Bangladesh, India, Pakistan, and a few other countries that are very, that have much more capacity than certain others. So, the Laoses or the Malawis or other countries struggle to get into that middle tier where you attract research funding and you develop a research reputation. So I think we need to think also about that issue of networking between think tanks, and maybe how more experienced think tanks in the sort of upper middle income countries can support development of capacity in sort of the least developed countries. And some of this, I think, there is scope for thinking more imaginatively. Nancy Birdsall had a great article called "The 7 Deadly Sins of Development Cooperation." It's very old, 2005. And it talked about, donors should pay a tithe. It could be tiny, but you need to start pulling all of it, and maybe do it at a country level. Every donor to a country says, you pay 1% of your annual aid budget into supporting independent research. She emphasized evaluation of aid-funded projects, but put it into funding national research capacity, national research institutes of different types, universities, think tanks, research capable national NGOs, and that would be one way of moving away from this. And I think this would be a sort of Paris Principles idea, that it would be good to go back and re-incentivize. The final thing, and I'm conscious I'm half a minute over, is thinking about the incentives for researchers. So partly this is on the donor side, partly it's within the sort of global northern international research system. So how do universities create incentives along with research and publication and teaching, and your ref scores and everything else? How do you create incentives, meaningful incentives, for saying we are helping to build international equitable research partnerships? And I think that's quite a hard one to capture, but I think that needs to be part of the equation as well. And the final thing would be, I guess, translation. So a lot of this is assuming that the language of academic publication and all the rest is English, and it will be substantively, but let's set meaningful funds aside for translating this into the languages where it will get traction with different communities as well, and doing good translation, which often drops by the wayside. And I'll leave it there, but thank you for an incredibly productive and useful set of discussions, and really look forward to seeing how this goes, and just immense thanks to the COVID Collective for what it's achieved. Thank you.
Great, thanks so much, Tim. So it's been a lot of talking, a few moments for a couple of questions. I hope that panelists would be willing just to stay on a little bit longer. I think so much of what's been talked about, it resonates with colleagues, whether it's on research, whether it's on knowledge translation, whether it's on partnerships, whether it's on learning, whether it's on the research itself. There are so many takeaways, I think, from what we've heard today. But let's just open it up quickly. If anybody would like to ask a question, you're welcome to do so. Gary has a mic, and James has a question. And are there any questions online? One, okay. So let's give James first shot. Jump in.
Thanks very much, James Georgilakis from IDS. Andrea mentioned right at the end there that the pandemic seems to have created a space for for leadership for individuals and institutions that maybe traditionally have been treated as the local partner. And I'm really interested in that. So, I mean, the language of equitable research partnerships can seem quite abstract at times. And it seemed to be one of the main things that happened in the pandemic is just the northern partners just couldn't get on a plane and go anywhere. And that in itself seems to have created an awful lot of opportunity. So short of just taking northern academics' passports away, what could we do to sustain that change in the roles performed by different people in research teams and maintain that leadership for organizations in the Global South. Thanks.
Great. Thanks, James. Any other questions in the room? Anybody would like to throw in just now? We have a chance. Stunned. Everyone's thinking about the time. What's the question we have online, Gary?
Yeah, this is from Kelly Shepherd, formerly of IDS. So great to see everyone. I look forward to reading the bulletin. Cutting across the research portfolio, I wonder what are the clear synergies and what ideas are there for further areas of mutual learning between projects? What could be the potential support required to take these forward?
Great. Okay. So I'm going to just go to Andrea. And Andrea, maybe can I just get your view? Perhaps Adrian as well. I might just come to you just on the question that James raised about how to maintain this let's say emerging leadership that is already being shown amongst institutions in the Global South, which perhaps has been given more space during the pandemic. What kinds of support, or what kinds of effort can be done to maintain and grow that? So maybe Andrea first, and then Adrian.
Well, I think that the main thing that has to be done is that the think tanks, the organizations in the Global South need to step up and ask for more. They have now the backing of their own capacity to say, we can do this. We don't need, we need partnerships that work differently because we can show that we work differently. And that includes unpacking what are those things that give value to the organizations in these partnerships. And I think one of the things with COVID is that it was in many cases the response had to be so quick that it really showed where the organizations had already the capacity in place, like Adrian was mentioning, that had already, those networks, those, they were well embedded in their national context. They can respond much more quickly. They can connect with others much more quickly and do things in a much more efficient way. And maybe some of these things don't show up that much when you are in a regular project cycle, but they show up very quickly here. So I think maybe some of those things are not apparent right now when we're discussing these partnerships of all these kind of like hidden or unseen capacities that these organizations have. But my main point is that organizations in the Global South have the opportunity now to step up and ask for different types of partnerships.
Great, thanks, Andrea. Adrian, and then I'll come to Orzala after that. And just ask
the quick answer is to be very intentional about who you're funding and when. And so, I mean, as a starting point, don't fund northern institutions to be your main actors for promoting change through research in Global South context. I think actually Tim very nicely outlined a bit of a roadmap that we're following. So we look to countries where there's a bit more established strength in institutional capacity. There's high capacity people in every country that I've ever worked in and been to. And so we use the group in Kenya and Nairobi to then as a hub for people in Malawi, Zambia, and other places to then think about shared learning, but then we might have a global hub who can do the comparative work across countries, convene people across regions. One thing that some colleagues have launched in the last year is some research chairs on forced displacement within universities in the Global South, very intentionally within universities, because they provide a safe space for debates on issues where you might not be able to do in civil society. Flip side, there's also a northern partner to open academic spaces where people have been on the outside from the Global South. And so that's a very intentional way of opening spaces and using positionality, different power dynamics within academic spaces. And then I think it's 100% about what your metrics are for success. If it's peer-reviewed journals within northern academic circles, you're going to condition one type of research and one type of researcher. We don't use that. We have different frameworks. One of it's called Research Quality Plus. We really look at policy uptake. And so it's really who you're funding and why. And so we start with the Southern partners. It's not always the Southern partners. We look at a very intentional mix. So thanks.
Great. Thank you, Adrian. Orzala?
Thank you, Peter. I just also wanted to add ARU or our experience in that case, particularly with this project. And I think this was a great example of this dynamics between the northern versus southern partnerships. In our experience, what happened that traditionally Afghanistan Research and Evaluation Unit as an Afghan research think tank was always partnered with, for example, ODI in the UK. ODI as a northern partner versus ARU as a southern partner. In this particular COVID collective, as it happened, we sort of turned this around, and ARU was on the lead, and we had the international partners and colleagues in the international partner organization as our partners working with us. And in that way, we saw clearly a lot of, instances where the dynamics, although like contractually speaking or managerially speaking, were different. So we were on the sort of lead versus our northern partners becoming our partner in this project. But at the same time, it also proved an example that this whole partnerships needs further, unpacking and needs further continuation, in the sense that it provides this opportunity where a lot of learning can also come from the field to the academia, to the national, to the northern sort of lines of learning and understanding. So I just wanted to sort of give this example, because for us, this was first time having seen this change in the dynamics, and it went excellently well. We have produced even more publications, we worked even more in spite of dramatic, challenges and constraints there, but the whole dynamic worked in such ways that our reliance on the virtual opportunities of communications and interactions really didn't mean much that we didn't meet. Well, unfortunately, still I didn't meet my partners in face-to-face, with exception of probably once or twice, but it really was very helpful that we did it in this way. And I just wanted to also share that experience. Thank you.
Great, thank you, Orzala. And that feels like a positive point to kind of draw the conversation to a close. Just from Kelly's point, hello Kelly, I think synergies for areas of mutual learning, in a way, they are being generated through those partnership approaches, because I think who asks the questions and the kinds of responses which are being raised are coming differently when sometimes those typical partnership relationships are being reversed. We have other examples, which are continuing now, where our partner, we at IDS are partnering with colleagues, and we are, they are the lead, and we are partnering with them, and that is becoming a more frequent kind of mechanism that we're using. And the learning processes through that change, because we all have unconscious biases, assumptions about who gets to speak, whose views count, and I think shifting the nature of partnerships and collaborations become certainly hopefully more equitable, then that does raise the whole question of how you frame even the initial questions. And then what we've learned through this discussion about methodologies is part of that conversation around mutual learning, which is going to continue. And again, some of that work is hopefully going to go forward around actually testing out some of these adapted methodologies in different contexts to see how they'll really work in practice. So I'm going to draw this amazing collection of panelists and discussion to a close, because time is not on our side. I would like to thank everyone who's been involved today. The bulletin is online. Those who are in the room, you will see on the way out, there is a previous IDS bulletin. So it's not the bulletin for this one, but this was one that we put out last year, which is basically a series of position papers that were thinking beyond the COVID pandemic at that time about future directions for development. Now with the bulletin that we've just released online, you'll be able to see sort of how thinking has progressed. And I think you've heard very much from the discussions today that those are thinkings about methodologies, they're about relationships, they're about partnerships, but they're also sharing the findings of the research that came out through the work that was done in an array of contexts. I must thank all the panelists who joined us today. I think all the panelists would want to acknowledge that they are one contributor to papers along with a number of others as well. So I'm hoping online today we had a number of the other contributors who also were part of the authorship of the articles in the bulletin. I would like to thank all of them. I would like to thank the editorial team as well, and as always, the reviewers who ensure that the quality of the IDS Bulletin articles are of the highest possible standard. I think it's a really exciting issue. I would encourage you all to read it, to share it, to talk about it, and I hope very much to continue these conversations going forward. So thank you to Gary and the team as well for all your technical support to make this happen. All those who joined online, all of you in the room, thank you very much. And I hope the conversation will continue. Thank you.